NTA, Channel 12.
Hello there, thanks for joining us on Health Matters Yet. Another very interesting edition where we are going to x-ray issues that concern you. Our focus is to ensure that you keep healthy and fit. I remain your host, Umo Basi Edit. And today we have in the studio here Dr. Obong Essien, who is the consultant orthopedic surgeon with the Akwa Ibom State Ministry of Health. Hello, doctor. Welcome to the program.
Hello, thank you for having me.
Okay. And we are going to be discussing several issues about bone matters. Bone, what do you know about bone? Basically, the topic we are looking at today is arthritis. I know that this is a common ailment. A lot of people go down with arthritis. Some people think it's arthritis, meanwhile it's not arthritis. And then some people go to the extent of indulging in some local therapies, all in the name of treating arthritis. And so that's why we had to bring Dr. Bowen into the studio today to do justice to this topic on arthritis. So doctor, what is arthritis?
Okay, thank you for the question. Arthritis is a very interesting topic, very interesting illness that affects lots of people, especially the middle-aged and elderly people. Arthritis basically is a condition where it affects the joints. In the joint, apart from the bones making up the joint, there's a cartilage, something like a plastic in between the joints. The function of the plastic is to prevent the bones ends from touching each other. So what arthritis does is that it attacks that cartilage, attacks that plastic, destroying it. So in that process, it causes pain, deformity, and other problems the patient may have.
Okay, so and then like you made mention, you said the middle age and the elder. That's like what age bracket now, to be specific?
Okay, arthritis is common amongst people from 50 years and above. Even though younger people can still develop arthritis, depending, there are several causes of arthritis. So, but the common age group is from 50 and above, and those ones may be due to part of aging process and other conditions that they have developed in the course of their lifetime.
Okay, is it genetic or something? Something you inherit?
Yes, there's a group, a type of arthritis that runs in family. That's why you will notice in a particular family, the grandparent had knee pain, the father had knee pain, and now the child is developing knee pain. So there's a type, not all types of arthritis actually, but there is a particular subtype that runs in family.
Okay, so that takes us to the types of arthritis. Could you just highlight some of the types, common ones that we may need to know?
Okay, the common types of arthritis include degenerative arthritis, also called osteoarthritis. That is the one that we commonly see around, common in elderly people. As one gets old, the normal wear and tear of the body can result in arthritis in the joint. That's what we call osteoarthritis. There's another subtype called rheumatoid arthritis. A rheumatoid arthritis is an autoimmune disorder. That is, the body is fighting against itself. So the body recognizes this cartilage as a foreign body, therefore mounting immune response against it, in the process destroying it. What is this kind of rheumatoid arthritis runs in family, commoner in females, runs in family, so you tend to see, and it affects multiple joints. So you tend to see somebody coming with pains in the fingers, in fact, any joint in the body can be affected. That's rheumatoid arthritis. Then we also have another subtype, the post-traumatic arthritis. Usually, if once any joint in the body is injured, there's a risk that that joint will develop arthritis, irrespective of the age of the patient. Meaning that a 10-year-old child that has sustained a knee injury that has affected the joint has a very high risk of developing post-traumatic arthritis in that knee joint. The same, so irrespective of the age, post-traumatic arthritis can occur. Then there's another subtype, the septic arthritis, usually as a complication of infection in the joint. As we said, the cartilage is prone to being destroyed by either blood cells or inflammatory factors. So if there's an infection in the joint, as part of the inflammatory response, that cartilage gets destroyed, resulting in arthritis. Those are the common cause of arthritis. Then there's another group that may be as a result of deformities around the joint. Usually, especially in the lower limb, the legs down, should be in a straight line, so that when you are standing, your weight passes through a straight line to the ground. But if there's any deformity, especially around the knee, so that the weight of the body is not taking a straight line, the joint now develops some areas of stress that will predispose to developing arthritis in those points.
Okay, now how can somebody readily know that he or she is having arthritis? What are those symptoms associated with arthritis?
Okay, that's a very interesting question. The symptoms of arthritis varies, but the common symptoms that may suggest that what you have is arthritis include pain in that joint. The pain that comes with arthritis usually is like a persistent pain, but it's worse after periods of inactivity, such that by the time you sleep and wake up in the morning, that means you've not been using your joints. By the time you want to start moving, you have severe pain at that point, which may gradually reduce, even though it may not stop completely. The same thing if you sit for a long time, when you want to initiate movement, get up from the sitting position, you feel severe pain at that point. Those kind of pain usually suggest arthritis. Then another symptoms of arthritis is stiffness. The joints gradually become stiff over time. If you discover that you cannot, for example, if it's arthritis in the knee joint, you discover you cannot fully flex or extend your knee over a period of time. Then for the knee joint, you may also have things like what we call locking of the knee, where you suddenly feel the sensation that you cannot either extend your knee completely. It's as if there's something blocking that movement in your knee. That's another feature the patient may present with. Then if the arthritis is affecting joints like the hip joint, you may discover that you walk with a limb. After some time, the leg may appear to be shorter because that cartilage is being destroyed. It now reduces the total length of that limb, so you may have that sensation of one leg being shorter than the other, apart from pain. Then once in a while, you may also have a swelling around that joint.
Wow, in case you're just joining us, the program is Health Matters, and we have here in the studio Dr. Ubong Essien, who is the consultant orthopedic surgeon in Akwa Ibom State Ministry of Health. So we are discussing arthritis today, and what idea do you have about arthritis? Don't touch that dial, just stay glued to your TV screen. So, doctor, moving forward, we've talked about the symptoms and the types of arthritis. What would you say are the common causes? What are those things that we are doing and we are not doing right? Apart from maybe genetics, that, okay, you are ordinarily predisposed to arthritis. What are those other things that you think are the causes of arthritis?
Okay, apart from genetic, which you've removed, and degenerative, which is as a result of getting old. If all of us get old enough, we eventually have one form of arthritis or another. So that one is not preventable. But other things that can cause arthritis, especially arthritis in the knee and the hip joints, include things like overweight, obesity. Because the more weight you have, that means the more weight those joints have to carry. So it acts as an extra stressor on those joints, and it will fasten the degenerative changes in the joint, resulting in arthritis. The other thing that can cause arthritis is injuries. injuries around the joint. And commonly, when we see patients and we ask, have you had injury around the joint? Most people tend to think about injury in the immediate past, maybe year or years. But injuries that you sustained even when you were small is a very strong factor that can predispose you to developing arthritis in that joint. Because what happens is that once the joint is injured and the joint surface is no longer straight, as long as the surface is not even, there's that risk that arthritis will set in. Another factor which I mentioned earlier is infection. Infection involving any of those joints. And septic arthritis is common in children. So most of these infections are childhood infections that may not have been well treated, well managed. Then as the child or as the person gets older, it now starts developing arthritis in those joints. Then those are the major. Okay, yes, and another common cause is deformities around the joints, bow leg, care legs. What, as I explained earlier, if the body is of the legs are supposed to be straight so that the weight of the body is carried in a straight line. So if there's any deformity around the joints, it means the alignment of that limb is not proper. The loading in the joint is not even. So the part of the joint that is carrying extra load will now tend to develop arthritis. So you now discover that for somebody that has a bow leg, he will start having pain around the inner side of the knee. Whereas if the person has a care leg, he will start having arthritis in the outer side of the knee. So all those deformities is better to be corrected early before arthritis sets in. Once arthritis sets in, it complicates the treatment for the deformity and the arthritis.
Okay, are you saying that care leg and bow legs could be corrected?
Yes, care leg and bow leg can be corrected. Can be corrected in childhood, which is the best period. Even in adults, there are procedures that can be done to correct them.
Surgery? Through surgery?
Yes, through surgery. But it depends on the cause, especially in children. One of the commonest causes of limb deformities in children is rickets. Okay. So if it's something like rickets, usually by the time you correct the vitamin D deficiency, it corrects on its own. But by the time the child grows into adulthood, surgery will likely be the only option of treatment.
Okay, still talking about the causes, we are looking at sedentary lifestyle, because you see that people in the village, like they have to go to the farm every day, they hardly come down with arthritis. Have you noticed? Or I'm the only person with these statistics?
That is true. Sedentary lifestyle affects almost every facet of the body. What happens is that the body is meant to move. So the inside the joint, apart from the bone, the cartilage that we've talked about, there are ligaments, and there's also fluids, which we call a synovial fluid. It's like it bats the cartilage, it bats the joint. So the more active that joint is, the more this fluid is produced, the more turnover of the fluid, so that the waste material produced by the cartilage, by the bone, is removed faster, new fluid is replaced, and that tends to prevent, has a protective effect on the joint. Whereas if you are inactive,